Today we're here to talk about the Dreamcatcher and how we were able to change our Center of Excellence to accommodate and to really meet the needs of the First Nations communities.
The Dreamcatcher service delivery model in our community is wonderful because it brings different organizations and services in our community together to help somebody that really needs it.
New-Brunswick FASD Dreamcatcher service delivery model is a delivery model that is based in working with the Truth and Reconciliation Commission on Sinclair's work and the 94 recommendations that he gave to the federal and provincial agencies. It is a model that, for the first time, has created the space for inclusion of the relationship and partnership for First Nations people and our healthcare service model for FASD to connect. One of the key elements was the inclusion of First Nations writings, materials, and research coming right from the First Nations communities. And the theory was derived from Leroy Littlebear's work in science. He talked about First Nations science being natural law and talked about the scientific method that we use in healthcare services. His work for us was key in the collaboration of bringing these two worlds together when working with our clients who come through the FASD Center of Excellence.
The client feels safe because they've chosen the people that are on their Dreamcatcher team. They know who they want to be part of that team, and they trust those people already. So for all those people to come into a room together and support and love this person, it makes a huge difference.
We didn't know what to expect, but we had like an idea, and I was really happy and I couldn't wait. And so it was, for me, it was like finally doors are gonna be open and we're gonna be having help.
You are the ones that really are the expert because you're the one that knows what your life is all about. We're witnesses and we are there to support, and whatever knowledge we have, we give, and if we think we don't have that knowledge, the Dreamcatcher pushes us to look at all determinants of health and to seek help elsewhere so you get the best service possible.
Even though we've made major steps, there's still a lot of steps to do. But we know we're not alone in the process. And the boys, they're the never-running reason for everyone working together.
There's more respect between like not just parents, like all four of us. More family activities, going walking or family nights, movie nights.
It was a really good experience too, and we accomplished a lot since, and it kept us motivated to keep going. I'm really happy to see where we're at now, thanks to the Dreamcatcher.
For us as a people, land base is something that's, we would say, culturally relevant. A lot of it is about the connections, the relationships that we have, not just with human relations, but everything else around us with Mother Earth. I think it's interwoven within a lot of the things, especially when they work with First Nations communities and First Nations clients. It's a very gentle process that's I would say more client-paced. It's paced on the client's needs as they're moving through the process, ensuring that the sacredness of the client's spirit is always taken into consideration.
The model was actually not created by us. The model was given by First Nations elders in order for us to be kind of a channel. For us, it's really opening the Western medicine world to new experiences and to new ways of doing things.
The Dreamcatcher model is about the ability to dream. All of our people have a dream. Everybody has a dream. And the dream, a lot of the time for families with children that are struggling with fetal alcohol syndrome, a lot of the times the dream has somehow faded. And for us to be able to incorporate some of these things, and for us to be able to be kind of like the catalyst for them to be able to continue to build a dream again, so that they don't lose hope. Because all of these families, all of these children, they all need a chance. And so if this can give them a chance, let's go for it.